We're going to talk about the lip flip. So with the lip flip, you can do it with toxin, you can do it with filler. If you're doing toxin, it's either half or 1 unit maximum of Zeo or Botox or whatever you use, Nuceiva, I don't know what you guys are using. Or you can use 2 units of Dysport, and you do it along the vermilion border in 5 injections. 1, 2, 3, 4, 5. The lip will flip slightly up like this. You're going to unfurl the lip, because remember I told you that lips have a tendency to unfurl, when they mature, so you want to get that back again. And you warn the patient that they might have trouble clearing food from behind their lip. They have to do it with their tongue for about a day or 2, because you're using small amounts of product. You're moderating, not obliterating. And that they might have trouble drinking through a straw. Okay, but that lasts for maybe about 3, 4, 5 days, and then they get back to normal. Because when you moderate and you don't obliterate, your brain resets, and it's able to handle it. If you try to obliterate the movement over there, you're going to get into trouble. Okay, it's going to be too much. And then you can do what they call the Russian lip flip. How are we doing here? It's almost back completely. Okay, you're doing great. Can I have... Yep. So, what you do in a situation like this, from the cupid's peak, okay, to the alar base, in this region right over here between the two, you're putting in what Julie Horn calls vertical fences. When you do that, you start from the red part of the lip, not the white part. Remember I told you the product runs backwards through the needle tract, and you don't want the product to accumulate outside the lip. You want it to accumulate just inside the white roll. We turn her head towards us, going to feel a little stick, and what I'm doing over here is I'm pulling the lip back, and I'm flicking it in like that. And then I'll very gently advance it over here like this. Slow injection, very, very slow. I'm injecting, and as I'm injecting, I'm pulling back. And as I pull back, I let the product come right out of the skin. Do you see the way it's sitting on the actual border? And you stop. That's what you do. It's multiple little fences. And I usually do it after I've, at the very end, because it will cause a little tear. It's very sensitive. And most of the time, if you're going to do the lateral part of the lip, you can do it horizontally. So, I made you tear up there. It's about time I did something for you. Okay? Again, she's being very good. So, a little flick right here. Down, inject. As you're slowly injecting, let it come out of the top. Another one, flip, down, inject, pull it out. Just like that. Multiple little things. You don't have to do it on the lateral aspect of it. And what you start to do is you start to turn the lip out. We got to be very careful with her because of the fact that she has very prominent bone structure here that's pushing her upper lip forward to begin with. If you want to do lateral part of the lip, you can flip the lip like this, and then you can do submucosal injection as you slowly advance. That one, I bet you, wasn't anywhere near as bad. No. But that's the idea behind the lip flip, and what you start to notice is the fact that you're driving the vermilion border north by doing that. Okay? We'll give you one more just towards the base over here. So it's a little flick. And I just had a patient that was, when I was doing a pop-up in Miami, I had a patient that came in that had lip asymmetry. So she had a lip that disappeared this way when it was coming out laterally. So all you do is you do those same little fences over here, a couple of small injections, and you get more vermilion show. Okay? So, let me take a look at you. Yeah, it's giving you a little bit up. We're good. We're very good. The product has a little bit of epi in there, so you can see that there's a little bit of blanching over here. And here, we're practically back to our normal color, but I'll check it again to make sure. Let me clean that up. Yeah. Yeah, you're almost there. Just a teeny little bit. There it goes. You can see the vascularity, the capillary refill coming back. So to review on her, we did forehead. We did temple with bolus, and here we did it with the subdermal. We did the bolus technique that I got to do on the other side to balance her out. We marked out her cheek. We did bolus and push. We also did the cannula, and we did the double scoop technique over here and a single bolus over here to go ahead and to tighten her ligament that she has over here. We did a couple little fills over here that we saw that was missing. We did the swift lift, or whatever you want to call it, the doorstop technique to tighten her up, and we gave her a little bolus over here for the gonial angle. We did her chin, but we did it superficial because we didn't want to touch her implant over there. We did some streaking over here. Upper lid, but I don't call it that. I call it the infrabrow. And then we did this perioral brow over here. We did some nose injections here, here, and there. I can't believe that she's been sitting here that long and taking all that, but that's what she did. She really deserves a hand. Needle for that same product, that shape, right? Okay, and what we're going to look at over here is I find that for her, her chin is just a little bit wide. But whenever you look at the chin, let me have the caliper, please. Whenever you look at a chin zone, it's a zone, not a chin. You have to look at it, what? Yep, okay. Whenever you look at a chin zone, thanks for reminding me, you take a look and you have to decide on height and width, okay, as well as projection. So if we turn from the side, and she's had surgery with a chin implant in there, so this makes it interesting. If you take a look at where her lips are projecting, you see that the chin is quite a bit behind it, right? It should be about 1 millimeter behind in a female, or perhaps touching. In a male, it's got to be touching or ahead of it. We'll look at the male patient we're doing next afterwards, okay? So that's for projection. For width, I told you it should be about the width of the intercanthus. In females, it's a straight line from eyebrows to canthus to base of nose to volume of lower lip to chin, and she's a little bit wide over here. Then we have to look at height. And what I do to understand height is I go ahead and I take the intercanthal distance, and then I go from the upper part of the lip down to the chin, and her height is fine. It's perfect. So all I really need to do is to advance the chin this way. Normally I would go right down on bone because of the fact that I want to project the chin this way. But she has an implant in there and I don't want to touch that implant. Let me see what we can do here. I'm going to do a little injection. You saw me do the drop technique if I want to lengthen. I want the product to come up this way, so give me the same product on a needle. I don't want to get anywhere near there with a cannula or a needle. I'm going to turn her head to the side so you can see it. And what I'm going to try to do is I'm just going to give the chin an appearance of a little bit more of a heart shape. Thank you. By giving you a little injection over here, okay? So I balance my hand. Normally we always would combine this with toxin, right? Stick out your lower lip. Wouldn't you want to do that on her? Look how tight it is. So normally we would do that. I'm balancing my hand. You're going to feel a little pinch. And I'm only in part way. Can you see the depth? So I'm going to go ahead and I'm going to slowly start to inject. Very slow. There are paracentral arteries over here, which are called the ascending mental. Here comes my injection, nice and slow. And then what I'm going to do is I'm going to give you a little double scoop, because I'm going to see if I can use a small amount of product in the sub-Q to go ahead and to project. Bingo. Always respect product that's in the face, or there's an implant or something. So if I get patients that have had facial trauma that have plates in their face, I don't go there. I just don't want to introduce a needle or anything around there that you find out afterwards that you bring in one little bacteria and they have an implant in there and then you're draining for life unless you take that implant out. So we're well away from it, okay? You're good? Let me have that product, the shape again on the same 27, not the 29, the 27 gauge needle. So to go ahead, I can do that on her because interestingly enough, her angle is over here where it belongs. I can do that over here, okay? But normally what we would start to see is the angle move up over here. So if her angle was over here, and I felt that I really wanted to lengthen her jawline over here, then I would go in with my cannula and create that L lower down. Okay? I see people nodding their heads. They must understand what I'm saying, because I don't understand what I'm saying. Okay, so here's the 2 fingers. Here's my hand parallel to it. Here's a little pinch, and I have to go down and touch bone. You see how I can't move her now? And now I start the flow of product. You can aspirate, but there's nothing here if you're on bone. And I slowly start to inject, monitoring the skin, and I still look at the glabella. If anything gets into the facial circulation, I want to know about it. And I inject very slowly. And this is one of the bigger boluses that I'll use, this and the chin, which we're going to do on her next, because she asked me to do her chin, right? Mm-hmm. Okay. And so I'll use about a 0.25 or a 0.3 cc injection over here, just like this. Okay, and we're almost done. Is that painful for you? You don't have to shake your head and tell me no? No. The answer is no. Out it comes. And what you do is you create the light and the shadow. Just like you saw on the last video that I showed you, where I'm sure that a lot of you are noticing it's all in the lower face that you get that beautiful definition. You're getting that beautiful definition like that, okay? You can do this on her, because she's got that gonal angle, but otherwise I would do it with a cannula. Okay, good. Turn your head this way. I'm going to show them 2 more injection techniques, and then we'll do a little bit something on your eyes and lips.